All right, welcome back to ABA Exam Review and the continuation of our RBT practice questions series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. James works with a client for 1 hour during school days. James notices that when the client goes to the restroom, the teacher requires that the door be open so that the teacher can check on the client. James knows the client is able to use the restroom independently. What should James do? Now, kind of an interesting question, and it is a ethical question about client dignity. So when we talk about client dignity, we are just talking about treating our clients with the same respect that we would give anyone else, regardless of if they were a client or if they weren't. And so these situations can be tricky for technicians, given that the ultimate responsibility lies on your supervising behavior analyst. And this is even more tricky because James is not in a clinic setting or a home setting, but he's in a school setting. So he's in an environment that isn't necessarily controlled by him or the analyst, but rather a teacher. So when he sees that a client who can independently use the restroom is being told to leave the door open when using the restroom, James is thinking, or should be thinking, is that dignified for the client? You wouldn't ask someone you know to leave the door open if they could use the restroom independently. There's no dignity in that. Now, as the technician, what should James do given the environmental setting he's in? A, confront the teacher and ask why the door is required to be open. So this is not James' place. James's place is to implement the procedures and to take data and then report back to the supervisor. James is doing the right thing by questioning whether this is right or not, but he might not have the full story. B, disregard the teacher's request and close the door for the client. Regardless of what the teacher is using, that is their environment. They're in the school. James is not controlling the teacher's environment. He cannot just disregard the request. C, inform the supervising analyst of the situation. Yes, there may be something James doesn't know. Maybe the supervising analyst and the teacher have already talked about this and they decided it was the best course of the action for the client. If that's the case and James just disregards or confronts the teacher, he could create more problems than necessary. He needs to inform that supervising analyst of the situation because ultimately it's their responsibility. And then D, schedule a meeting with the school principal. No, the first thing we need to do before confronting anybody as the behavior technician is go to your analyst. If you see something, if you think something, if you feel something is wrong, the first person you talk to is your supervising behavior analyst. While working Carlos on his daily living skills, you're teaching him how to independently make a simple sandwich. You have broken down the task into several steps: gather ingredients, get bread condiment, etc. Carlos successfully completes the first 3 steps, but struggles with spreading the mayonnaise evenly. To provide the most effective prompting according to a least to most prompting hierarchy, your next step should be to do what? We've got to consider a couple things here. 1, we want to be the most effective at prompting, and we're going to use the least to most prompting hierarchy. So whatever answer we choose needs to go least to most, and it needs to be effective because we're working Carlos on daily living skills. And the issue is he's not spreading the mayonnaise evenly. So maybe he can spread the condiments, it's just not even. So if we want to prompt spreading of the mayonnaise evenly, least to most, where should we begin? Well, A is physically guiding Carlos' hand to spread the condiment. B is using a graduated guidance strategy. C is modeling how to spread the condiment evenly on your own sandwich. And D is pointing to areas of the bread where there is no condiment. So if you think of least to most as this hierarchy where we're starting with the least intrusive behavior and it's forming a pyramid, we're going to have something like errorless teaching at the top, physical prompting, modeling, and then we're moving down that hierarchy. Pointing or a gestural prompt is going to be further down than anything like physically guiding Carlos's hand. The graduated guidance is just a form of physical prompting, and then modeling is going to fall right below physical prompting. So if we're going to be effective and use least to most, the least intrusive prompt out of these 4 is going to be pointing to the areas of the bread where there is no condiment. Your supervising analyst has asked you to implement a new intervention for a client, Ben, to decrease his grabbing of toys from other children. The intervention involves redirecting Ben to a preferred activity whenever he reaches for another child's toy. After the first week of implementation, you notice that Ben's toy grabbing behavior has not decreased and may have slightly increased. The ethical and effective course of action to take next would be to do what? This is very similar to that first question, right? We're trying to be ethical and we're trying to be effective as the technician. Your supervisor has told you to implement this new intervention for Ben. The intervention is redirection, but after the first week of implementation, where you're redirecting Ben from the preferred activity, you see that Ben's behavior hasn't decreased, but has actually maybe increased. And since this is not explicitly extinction, where we might expect that extinction burst, that could be an issue. Now, it's only been a week, right? Which might not be enough time to really make a decision. But as the technician, you're part of the team, you're an essential part of the team. And if you feel or see something that is wrong, again, or you don't feel comfortable about, you've got to take action. So, what's your next course of action in this situation? A, continue implementing the intervention consistently for another week to see if there is a delayed effect. Well, you already feel that something might be off, so you don't just keep moving forward without saying anything. B, modify the intervention on your own to make it more effective. You should never modify anything your supervisor's written in that treatment plan. They have to put their name on that treatment plan, they have to sign it, and typically they're going to submit it to an insurance company. They're responsible for it. Don't change treatment without permission. C, immediately stop the intervention since it doesn't seem to be working. Well, not necessarily. Maybe it's just a blip or an anomaly. So we're not just going to stop the intervention. What we're going to do, just like in the first question, we're going to communicate observations and data to the supervising analyst. And what you're going to find, and this is on the task list too, open, honest communication with your supervisors, always going to be essential. If there's ever an issue, the first person, we'll say it again, to go to is the supervisor. You're collecting data on a student's hand-raising behavior during group instruction. You've defined hand-raising as Sarah lifting her hand above her shoulder level while looking towards the teacher and waiting to be called on. During a 15-minute observation period, Sarah raises her hand correctly 7 times. How would you report this data if you were using event recording? Pretty straightforward measurement question. You just have to know what event recording is. An event recording is essentially frequency collection, where we're just counting every time an event happens, typically or often used during an assessment. So if we have this data on hand-raising behavior and we observe 15 minutes and Sarah raises her hand 7 times, how are we going to report that if it's event recording? Well, we're going to say 7 hand raises occurred. Event happened 7 times. That's straightforward. What about B, 0.47 hand raises per minute? Well, that would be rate, right? And we're not reporting rate, we're reporting using event recording. C, 47% of opportunities, Sarah raised her hand. That would be percentage of opportunities. And again, we're using event recording. We're just recording how often it happened. And D, hand raising occurred almost half the time of observation. True, but it's not very specific. How long was the observation? What does half mean? We need numbers. We need hard data. So if we're using event recording, how often did it happen? What was the count? What was the frequency? While working with the client during independent play, you notice that the client begins loudly singing and clapping whenever you turn to write notes. When you look up or say something to the client, the behavior stops briefly. Over time, this pattern repeats more frequently. What is the most likely function of the client's behavior? All right, function question. Function questions should be very easy. When we're talking about function, we're trying to figure out why does the behavior occur. Typically, behavior occurs to gain or get rid of something. So we want to often look at what's the consequence of the behavior, what's the outcome. If we have a client during independent play who is loudly singing and clapping whenever you turn to write notes, and then when you look up or say something to them, the behavior stops, what is your first instinct? Why would the client begin loudly singing and clapping? What do they get? Well, they get you to look up and say something, and then it stops. So what would you say is the most likely function? A, escape. Is the client escaping independent play? No, there's no escape present here. B, attention. Is the client getting attention? They are. They're getting you to look up and say something and then stopping the behavior until they need your attention once again. So this looks like attention. C, tangible. Did they gain a tangible item? They didn't gain an item, they gained your attention. And then D, automatic. Was this not socially mediated? Was this some sort of internal stimulation? No, it's all socially mediated. It wasn't automatic. Over time, as it repeats from getting attention, the likely function of the behavior is B, attention. Thanks for watching. Check out btexamreview.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. As always, work hard, study hard, and we'll see you soon.